MedTest.com's Pharmacy Technician Practice Test. For complete practice of actual exam topics, check out the Pharmacy Technician Practice Exam Kit with 800 questions and fully explained answers, written by instructors in pharmacy technician studies, former FDA reviewers, and subject matter experts in pharmacy. Pharmacy Law and Regulation. Question 1. Which of the following is used to report medication quality problems? A. FDA Form 79. B. DEA Form 222. C. MedWatch Form. D. Shipment Receipt. C. MedWatch Form. The MedWatch Form can be obtained from the FDA to report serious adverse events, quality problems, or product use errors associated with FDA-regulated products. The form is used to voluntarily report medication problems to the FDA. Question 2. Which of the following drugs is exempt from the Poison Prevention Packaging Act, PPPA, of 1970? A. Acetaminophen over 1 gram in a package. B. Oral contraceptives. C. Ibuprofen with over 1,000 mg in a single package. D. Powdered flavored aspirin. B. Oral contraceptives. The PPPA was an act established by the Nixon administration to decrease accidental ingestions of harmful medications by children while still allowing for seniors to access their medication. Exempt items include powdered unflavored or effervescent aspirin, oral contraceptives, ibuprofen, or acetaminophen with less than 1g, 1,000 mg contained within one package. Question 3. The Health Insurance Portability and Accountability Act, HIPAA, of 1996 established rules regarding patient rights to protect personal health information. Which of the following is not considered protected health information? A. Social Security number. B. Date of birth. C. Blood type. D. License plate number. C. Blood type. Protected health information is any distinguishing factor that is part of the patient profile and would allow for others to identify the person. Blood type is the correct answer as by itself it does not identify a single person. Social Security number and date of birth can identify a person. The license plate number can be used to identify patients through license registration records. Question 4. In 2023, the Drug Enforcement Agency, DEA, revised regulations as they pertain to Schedule II prescriptions and the ability to transfer this type of prescription. Which of the following is part of the updated regulation? A. Schedule II prescriptions can be transferred between any pharmacies. B. The transfer of the Schedule II prescription is permissible only once. C. An electronic Schedule II prescription can be faxed as a transfer to another pharmacy by a technician. D. All documentation regarding the transfer must be maintained for 18 months from the date of the prescription. B. The transfer of the Schedule II prescription is permissible only once. Per regulation, Schedule II can 1. Only be transferred between retail pharmacies, 2. Upon request from the patient, and 3. Permissible on a one-time only basis. The prescription must be transferred in its electronic form unaltered. The communication must be between 2 licensed pharmacists. Records must be maintained for 2 years from the date of transfer. Question 5. How many refills are allowed on C3 drugs? A. 5. B. 3. C. 1. D. 0. A. 5. C3 drugs can have up to 5 refills and are refillable up to 6 months. Some examples of C3 drugs include Vicodin and Xanax. Medication order entry, interpretation, and the fill process. Question 6. A 60-day supply for a prescription for Colace 100 mg capsule taken BID should be filled with A. 30 capsules, B. 60 capsules, C. 120 capsules, D. 180 capsules. C. 120 capsules. The correct answer is 120 capsules because the prescription is for a 60-day supply and directions are 1 capsule twice daily, BID. In other words, 1 times 2 times 60 equals 120. Question 7. A physician sends this patient's prescription electronically to the retail pharmacy. According to the prescription below, what directions should be given with this medication? A. Take 1 tablet by mouth now, then 1 tablet by mouth on days 2 through 7 in the morning before meals. Discontinue use and return if side effects are not tolerable. B. Take 2 tabs, fast dissolve now. Days 2 through 7, take 1 tab, fast dissolve in the morning, pre-coffee. Discharge and return to office if starting to burn or blood pressure increases. C. Take 2 teaspoons by mouth on Saturday. Days 2 through 7, take 1 teaspoon by mouth in the morning after meals. Discontinue and return to the office if shaking or bleeding or blood pressure increases. D. Take 2 tabs by mouth now. Days 2 through 7, take 1 tab by mouth every morning after meals. Discontinue and return to the office if shortness of breath or blood pressure increases. D. Take 2 tabs by mouth now. Days 2 through 7, take 1 tab by mouth every morning after meals. Discontinue and return to the office if shortness of breath or blood pressure increases. SIG code. TK, take. Tab, tablets. PO, by mouth. Stat, immediately. Q, every. AM, morning. PC, after meals. DC, discontinue. SOB, shortness of breath. BP, blood pressure. Question 8. A patient drops off a prescription for oxycodone 10 mg. Based on the Drug Enforcement Administration, DEA, diversion control, under 21 CFR 1306.05a, which of the following is not required for a pharmacy to consider filling? A. Date. B. Patient full name. C. Patient date of birth. D. Drug strength and form. C. Patient date of birth. Based on the DEA requirements, for a pharmacy to consider filling a controlled substance, it must contain date, patient's full name, patient's address, drug name, drug strength, dosage form, quantity, directions for use, prescriber's name, prescriber's DEA address, and practitioner's physical signature. Question 9. Inventory for Adderall XR 20 mg has been scarce for months, with continued back orders and intermittent supply. The pharmacy receives a prescription for the medication, quantity 30. When gathering the medication from the safe, there is an X on the lid, indicating it is not a full bottle. The technician discovers the inventory is incorrect in the computer system, and they are 10 pills short to fill the entire prescription. What is the best action for the technician? A. Inform the patient that they will need to call the doctor to have a new prescription sent to another pharmacy that has enough stock to fill. B. Fill for the quantity currently in stock, informing the patient that they will need to forego the additional 10 pills and return to their physician 10 days early to retrieve the new written prescription. C. Advise the patient of the low stock, offering to call additional pharmacies for stock status and, if found, have the additional stock transferred to their pharmacy. D. Based on wholesaler estimates, additional inventory should arrive in 5 days. You advise the patient and fill the 20 pills, then hold the remaining due from the prescription until the drug is received after the 5 expected days. C. Advise the patient of the low stock, offering to call additional pharmacies for stock status, and if found, have the additional stock transferred to their pharmacy. Under the rules for C2 medications, which include Adderall, Prescriptions are permitted to be partially filled if completed within 72 hours. Because of the extended backorder, it will be difficult to fill the remainder of the prescription on time. Controlled medications are permitted to be transferred between two valid DEA licensed pharmacies only once. Under ethics rule, the pharmacy tech should call other stores to try to determine the stock situation to keep the patient adherent to their medication schedule. Question 10. A PRN order is an order for a medication that is used on an blank basis in a hospital. A. Regular. B. Every day. C. As needed. D. Nightly. C. As needed. PRN is a medical term that means as needed. PRN orders are requests for medication that is not used on a routine basis. Instead, PRN medications are used only when the patient needs it, such as when Phenergan is used for nausea and vomiting. Pharmacology for technicians. Question 11. Pharmacy technicians can refer to the blank book to find out if two drugs are equivalent. A. Blue. B. Orange. C. Green. D. White. B. Orange. The primary reference for therapeutic equivalence is the FDA's approved drug products with therapeutic equivalence evaluations, commonly known as the Orange Book. It is the official source that provides standards which dictate drug equivalence. Question 12. Grapefruit and other citruses can alter the absorption of a medication. Which drug class and medication is contraindicated for severe interaction with citrus? A. Statins, simvastatin. B. Statins, rosuvastatin. C. Calcium channel blocker, amlodipine. D. Calcium channel blocker, felodipine. A. Statins. Simvastatin. Grapefruit and sometimes other citruses can alter the absorption of a medication. It can either block the enzymes causing too much drug in the body, or it can block the transporters and allow not enough drug into the body. Based on current guidance, statins such as simvastatin are contraindicated in citrus consumption. Rosuvastatin, amlodipine, and felodipine are not contraindicated. Question 13. Based on current CDC recommendations, what is not recommended best practice in vaccine storage? A. Store the vaccine only in the refrigerator door or crisper drawer. B. Replace crisper bins with water bottles. C. Do not put personal food or beverages in the refrigerator. D. Do not use the top shelf for vaccine. A. Store the vaccine only in the refrigerator door or crisper drawer. According to the CDC, vaccines should not be stored in the door of the refrigerator based on the frequent opening and closing of the door. This exposes them to temperature variations and light. Question 14. Lansoprazole is considered a proton pump inhibitor, PPI. PPIs are used to reduce the level of blank in the body. A. Carbon dioxide. B. Thyroid hormone. C. Stomach acid. D. Testosterone. C. Stomach acid. PPIs are used for the treatment of GERD by lowering the level of stomach acid, resulting in a decrease of symptoms. Question 15. What is the nature of a drug idiosyncrasy? A. It is an unexpected response to medication. B. It is an expected response to medication. C. It is a planned response to medication. D. It is a unique response to medication. A. It is an unexpected response to medication. Unexpected responses to medications are called idiosyncrasies or idiosyncratic effects. Compounding procedures and safety. Question 16. Before, after, and throughout each shift, pharmacy technicians should wash their hands with an antimicrobial agent for at least blank. A. 10 seconds. B. 30 seconds. C. 60 seconds. D. 120 seconds. B. 30 seconds. Pharmacy technicians should always wash their hands for at least 30 seconds, allowing the friction and antimicrobial agent to thoroughly clean the hands and arms. Question 17. The hospital retail pharmacy receives an order from an ER physician for a patient newly diagnosed with contact dermatitis, which caused large red welts to appear on his chest. The doctor orders hydrocortisone 1%, 80 grams, to be dispensed to the patient. The pharmacy has chosen to compound this medication using hydrocortisone powder. What is the required quantity of powder to fill this prescription for a 90-day period? A. 2.8 grams. B. 0.8 grams. C. 2.4 grams. D. 3.6 grams. C. 2.4 grams. 1% is equal to 1 gram of medication for every 100 grams. 0.01 times 80 grams times 3 to include refill equals 2.4 grams. Question 18. Based on the current United States Pharmacopoeia, USP, Chapter 800 guidance, if no specific agent is listed on the HD label for deactivation, which agent should be used? A. Ultrasonification. B. Peroxide formulations. C. Steam. D. 70% alcohol. B. Peroxide formulations. Peroxide formulations are recommended for deactivation. Per current USP standards, ultrasonification is used to inactive food enzymes, steam is used for inactivating microorganisms, and 70% alcohol is used as a cleaning agent. Question 19. Which requirements are outsourcing facilities subject to when compounding non-sterile preparations? A. HRSA. B. CGMP. C. Aseptic filling. D. CMS. B. CGMP. Requirements differ as they relate to quality of compounded drugs from one facility to another facility. In an outsourcing facility, most compounding is large batch, non-sterile preparations for unit dosing. This is a form of manufacturing, which falls under the CGMP, Current Good Manufacturing Practices. The other requirements do not regulate compounding. HRSA guides healthcare access for non-underinsured patients. Aseptic filling is related to putting commercial sterile products into sterile containers. CMS is the Centers for Medicare and Medicaid Services. Question 20. Which of the following defines a solvent? A. The solution. B. The active ingredient. C. The solution plus a solute. D. The larger part of a solution. D. The larger part of a solution. The larger part of a solution is called the solvent. A solvent is a substance, usually a liquid, that dissolves another substance to make a solution. Calculations. Question 21. A physician order for a 120 mg dose of gentamicin 40 mg-ml should be filled with blank of gentamicin. A. 80 milliliters. B. 5 milliliters. C. 3 milliliters. D. 60 milliliters. C. 3 milliliters. The correct answer is 3 milliliters because for every 1 milliliter of gentamicin medication, there are 40 mg. 40 mg times 3 equals 120 mg, which is the same as desired dose of 120 mg. Question 22. A teenaged female presents to urgent care after 3 days of not being able to swallow. Rapid testing indicates that the patient is positive for strep A infection and needs to be treated with antibiotics. Based on patient demographics, the current recommended dosage for the prescribed antibiotic is 25 mg/kg a day, divided into 3 8-hour dosages in a 24-hour period. If the patient weighs 132 pounds, what would be the single dosage amount for this patient? A. 1500 mg, B. 325 mg, C. 500 mg, D. 1100 mg. C. 500 mg. 1. Convert pounds to kg. 2.2 times 132 pounds equals 60 kg. 2. Find mg kg using the converted pounds, 60 kg, and multiply by the stated mg kg, 25. 60 times 25 equals 1500 mg. 3. Question requests the single dosage amount. The order is 3 times daily, requiring the total to be divided by 3. 1500 divided by 3 equals 500 milligrams per dose. Question 23. A patient in the ICU has an IV drip that is set to deliver 20 drops per minute. Given that there are 60 drops per ml, calculate the infusion rate, ml per hour. A. 400 ml per hour. B. 1,220 ml per hour. C. 2,000 ml per hour. D. 1,200 ml per hour. D. 1,200 ml per hour. 20 drips per minute times 60 minutes in an hour equals 1,200 ml per hour. Question 24. The pharmacy has a 3-liter bottle of 18% solution. A prescription for this medication is received, requiring you to use sterile water to dilute. The prescription requests a 12% solution concentration. How much sterile water is required? A. 4,500 ml. B. 540 ml. C. 1,500 ml. D. 3,000 ml. C. 1,500 ml. Concentration times volume equals concentration 2 times volume 2. 0.18 times 3,000 ml equals 0.12x. 0.18 times 3,000 equals 540 ml. Divide both sides by 0.12, giving you 4,500 ml. Your package is already 3,000 ml, so 4,500 minus 3,000 equals 1,500 ml of sterile water. For complete practice of actual exam topics, check out the Pharmacy Technician Practice Exam Kit with 800 questions and fully explained answers, written by instructors in pharmacy technician studies, former FDA reviewers, and subject matter experts in pharmacy. Question 25. There are blank ounces, OZ, in a pound, LB. A. 4. B. 6. C. 8. D. 16. D. 16. There are 16 ounces in a pound. This is a common conversion that is used when weighing material on a scale. Anatomy and physiology. Question 26. Epilepsy is caused by excessive blank activity within the brain. A. Chemical. B. Hormone. C. Blood flow. D. Electrical. D. Electrical. Excessive electrical activity within the brain can cause seizures. Grand mal seizures involve convulsions and can include unconsciousness. Petit mal seizures do not involve convulsions, but may include periods of stupor. Question 27. Name the substance that aids in the transmission of nerve impulses to the muscle. A. Ascorbic acid. B. Acetylcholine. C. Cyanocobalamin. D. Niacinamide. B. Acetylcholine. Ascorbic acid, vitamin C, aids in the formation of blood vessels, cartilage, muscle, and collagen in bones. The nerve impulse is aided by a mixture of acetic acid and choline. Cyanocobalamin aids in the production of red blood cells. Niacinamide is used in the prevention of B3 deficiency. Question 28. What is the major gland of the endocrine system? A. Adrenal. B. Pituitary. C. Thyroid. D. Pineal. B. Pituitary. The pituitary gland is the major gland that controls functions of all other glands in the endocrine system. Adrenal glands control the fight or flight response. The thyroid gland controls metabolic rate and energy. The pineal gland controls sleep and wake cycles. Question 29. What disease can impact the metabolism or excretion of a drug in a significant way, increasing the potential for drug accumulation and toxicity? A. Hepatic kidney. B. HIV, AIDS. C. Hypoparathyroidism. D. Cholestasis. A. Hepatic kidney. The kidneys oversee eliminating drugs from our bodies. If there is severe kidney failure or damage, any ingested medication would not be efficiently and completely removed, causing increased toxicity to the body. HIV/AIDS attacks the immune system and does not interfere with medication in a significant way. Hypoparathyroidism affects the endocrine system. Cholestasis is a drug-induced liver injury. Question 30. Which age range defines a neonate? A. Birth to 1 month. B. 1 month to 1 year. C. 1 year to 5 years. D. 6 years to 12 years. A. Birth to 1 month. A neonate is a newborn baby who is 1 month old or less. After a baby reaches the age of 1 month, it is then considered an infant. Inventory management and quality assurance. Question 31. While working in a pharmacy, a technician can locate storage requirements for a particular drug in which resource? A. Taber's Medical Dictionary. B. Davis's Drug Guide. C. United States Pharmacopoeia and National Formulary. D. Manufacturer Invoice. C. United States Pharmacopoeia and National Formulary. The United States Pharmacopoeia and National Formulary provides standards for storage. Details such as light, ventilation, sanitation, and temperature are also provided. Question 32. Define the 340B program as it pertains to the hospital setting, including hospital retail. A. An inventory control system for auditing dispensing of controlled substances. B. A system of separating the inventory in pharmacy purchased by the federal government for patients that do not have any insurance or means to pay. C. A program that allows covered entities to purchase specific manufacturer drugs at a discounted rate when compared to wholesale pricing. D. An inventory model used to purchase employee medication at a significant discount, therefore offering employees no-cost prescription to improve wellness and financial strain. C. A program that allows covered entities to purchase specific manufacturer drugs at a discounted rate when compared to wholesale pricing. The Public Health Services, PHS Act, established the 340B program based on the continued growing costs associated with care of patients who have no means to pay. This program allowed covered entities to procure certain medications, NDC specific, at a significant discount, allowing for that calculated difference to support additional programs and uncompensated care so as not to burden the community or bankrupt the hospital. These are not for-profit health systems. Question 33. Augmentin suspension should be blank and it will last for blank days. A. Stored at room temperature, 30. B. Stored at room temperature, 14. C. Refrigerated, 10. D. Refrigerated, 7. C. Refrigerated, 10. Augmentin suspension should be refrigerated and it lasts for 10 days. Medication administration. Question 34. The 7 rights of medication include all of the following except blank. A. Route. B. Gender. C. Time. D. Drug. B. Gender. The 7 rights of medication include the right patient, dose, time, route, technique, drug, and documentation. Gender is not one of the 7 rights. Question 35. What is true about drugs on the preferred drugs list? A. The drugs are all generic. B. Most drugs are brand name. C. The drugs are found to be inferior in management of disease states. D. The federal government has specified that these drugs treat orphan/rare diseases. B. Most drugs are brand name. The Bureau for Medical Services and the Medicaid P&T Committee have determined that these are NDC-specific drugs and are to be insurance-based financial, covered outpatient drugs. For a drug to be considered for the preferred drug list, the manufacturer must agree to a pharmaceutical pricing agreement with CMS. The agreement requires the drugs to be discounted. If a covered entity does not use the 340B priced drugs, a rebate for the drug is paid to Medicaid by the manufacturer. Question 36. What is an inventory system that allows a continuous record of inventory in real time? A. Perpetual. B. Point of sale. C. Physical. D. Reorder par. A. Perpetual. Definitions under the OPA, HRSA, and APEXIS. Point of sale is not an inventory type. Physical systems are updated periodically and not in real time. Reorder par is the level of inventory required to support the use of a specific drug. Question 37. What is the recommended maximum amount of medication that should be administered at one time for subcutaneous injections? A. There is no maximum. B. 3 ml. C. 0.8 ml. D. 8 ml. B. 3 ml. When larger volumes of medication are injected subcutaneously, it can cause an elevated level of discomfort in the patient. Therefore, a maximum 3 ml at one time is recommended, with 2 ml being the standard. While this is not a requirement, it is recommended based on research on patient comfort. Question 38. After administering a drug, the time when the body first starts to respond to the medication is called A. Plateau. B. Peak plasma level. C. Onset of action. D. Drug half-life. C. Onset of action. The onset of action is the time after a drug administration in which the body initially responds to the medication. Some drugs may have a rapid onset of action but a short half-life, while others may have a slower onset but their effects last longer. Professionalism. Question 39. A patient asks a pharmacy technician if it is okay to drink grapefruit juice every day while taking Coumadin. A pharmacy technician should A. Tell the patient that grapefruit is contraindicated while taking Coumadin. B. Tell the patient that grapefruit is okay. C. Refer the patient to a pharmacist. D. Tell the patient to call his doctor. C. Refer the patient to a pharmacist. Even though the pharmacy technician may know the answer to a patient's question, the pharmacy technician should refer the patient to a pharmacist because pharmacy technicians are not allowed to counsel patients on drug interactions. Question 40. If an IV injection of an antibiotic contains particulate matter, which of the following problems is of least concern? A. Anaphylactic shock. B. Pulmonary embolism. C. Phlebitis. D. Air embolism. D. Air embolism. Under USP 788, particulate matter is an undissolved substance, excluding gas bubbles, in a parenteral prep. Since particulate matter do not contain gas bubbles, this excludes risk of air embolism. Question 41. Which factors are not considered when choosing a route of medication administration? A. Physical and chemical drug properties. B. Impact on gastrointestinal enzymes or liver metabolism. C. Option for the oral liquid to be flavored by the pharmacist. D. Rate of drug absorption from different sites. C. Option for the oral liquid to be flavored by the pharmacist. Options A, B, and D are all taken into consideration when choosing the proper route of a medication. The only item that would not be part of the decision is whether the medication, if oral, can be flavored to the patient's request. Question 42. The primary role of the Pharmacy and Therapeutics P&T Committee is to A. Establish a drug formulary. B. Increase therapeutic redundancies to reduce the impact of shortages. C. Minimize cost effectiveness. D. Establish proper markup on drugs to maximize pharmacy revenue. A. Establish a drug formulary. The P&T Committee is a team made up of different providers within the healthcare system. It determines which medications should be preferred for use based on efficacy, shortages, cost effectiveness, etc. Goals of the committee include attempting to decrease therapeutic redundancies and maximize cost effectiveness. P&T, while considering cost, has nothing to do with drug markup. This is determined by a finance department. Question 43. Those who hold a credential of the National Certification of Pharmacy Technicians, according to the Pharmacy Technician Certification Board, PTCB, have an obligation to maintain high standards of blank and blank. A. Integrity and ethics. B. Ethics and hygiene. C. Ethics and education. D. Integrity and conduct. D. Integrity and conduct. Based on the guidebook for PTCB, those who hold the certification and are candidates must maintain a high standard of integrity and conduct. Conduct includes hygiene, while integrity includes ethics. Education is a requirement for recertification and is not part of the standards for professionalism. Question 44. What should countertops in IV rooms be cleaned with? A. Iodine. B. Iodide. C. 70% isopropyl alcohol. D. 90% isopropyl alcohol. C. 70% isopropyl alcohol. Isopropyl alcohol should be used to clean countertops, as well as the laminar flood hood and gloves in between IV admixtures. Equipment. Question 45. Laminar flow hoods require blank filters for use. A. HEPA. B. Water. C. Humidifier. D. Double. A. HEPA. HEPA filters should be used with laminar flow hoods. Question 46. Pharmacy technicians are not permitted to do which one of the following when assisting patients with questions and concerns about herbal supplements? A. Lead the patient to the area of the sales floor where supplements are contained. B. Advise the patient on which are the best supplements to take with their blood pressure medication. C. Advise the patient on current sale prices. D. Locate additional stock for sale. B. Advise the patient on which are the best supplements to take with their blood pressure medication. A pharmacy technician cannot make medical recommendations or represent themselves as a trained medical provider, as these all fall under the unauthorized practice of medicine. The pharmacy technician can lead the patient to various areas on the sales floor, advise the patient about sale prices, and locate additional stock for sale, as these are all not considered the practice of medicine. Question 47. Which of the following is one of the steps included in the proper cleaning of the horizontal laminar IV flow hood? A. Gather supplies from stockroom that have not been sanitized. B. Wipe at a right angle to the airflow. C. Clean from front to back, bottom to top. D. Ensure the hood is running while cleaning is completed. B. Wipe at a right angle to the airflow. Proper cleaning of the flow hood includes 1. While minding to wipe at a right angle of the airflow to prevent area from particles, clean the back wall. 2. From top to bottom, clean each side of the flow hood, ensuring to overlap lines. 3. Beginning in the back, continue to clean, moving towards the front of the unit. Question 48. Medicare Part blank will cover the cost of durable medical equipment billed by the pharmacy. A, B, C, D, D. B. Original, traditional, Medicare includes Part A for hospital insurance, Part B for medical insurance covering outpatient care, which includes durable medical equipment and devices. Part C is Medicare Advantage Plan, which covers vision, hearing, dental, etc., not covered by traditional Medicare. Part D is prescription coverage. Question 49. As a sterile compounding pharmacy technician working with non-hazardous chemicals, all of the following personal protection equipment, PPE, are required to comply with current USP regulations, except A. Powder-free nitrile gloves. B. Hairnet, bonnets. C. Eye protection. D. Lead-based aprons. D. Lead-based aprons. When compounding a sterile medication, one must use powder-free nitrile gloves to prevent harm to patients who have an allergy to powder found in normal latex gloves. Hairnet/bonnets are a requirement to prevent contamination and exposure by the compounding technician. Eye protection prevents injury from backsplash. A lead apron is required only for fluoroscopy, medical imaging. Question 50. Which scales are sensitive enough to measure a 650 mg to 120 g? A. Class A balance. B. Class B balance. C. Electronic scale. D. Household scale. B. Class B balance. The ability to accurately balance product is extremely important in compounding. The Class B balance measures 650 mg to 120 g. The Class A balance is only required to be sensitive enough to measure 120 mg to 15 g. Billing and reimbursement. Question 51. Medicare blank provides prescription coverage. A. Part A. B. Part B. C. Part C. D. Part D. D. Part D. Medicare Part D provides prescription drug coverage. Question 52. What three components are needed to bill a pharmacy claim? A. Member ID number, BIN, and PCN. B. The patient's insurance card, BIN, and PCN. C. Member ID number, BIN, and Condor code. D. The patient's name, date of birth, and phone number. A. Member ID number, BIN, and PCN. In order to bill a patient's insurance, you must have the BIN and PCN to ensure proper routing of the claim, as well as the member ID number to identify patient-specific benefits. Even if the patient does not have their card, benefit information can still be obtained if they are able to provide these three key pieces of information. Thanks for watching Test.com's Pharmacy Technician Practice Test. For complete practice of actual exam topics, check out the Pharmacy Technician Practice Exam Kit with 800 questions and fully explained answers, written by instructors in pharmacy technician studies, former FDA reviewers, and subject matter experts in pharmacy.